This is the fourth part of our lecture regarding ECG electrocardiogram. There are four important points should be assessed in order to determine if this rhythm is a sinus rhythm. ما بنقدر نحكي normal rhythm، لازم نحكي normal sinus rhythm. حتى نحكي sinus rhythm, the first thing which is very important, if the rhythm is regular or irregular. It should be regular rhythm, which means that the distance between each P and P is equal, and the distance between R and R is equal, so that we have an equal rhythm. The second point, that all waves are present. جميع الwaves موجودات. ال P wave موجودة، ال QRS موجودة، ال T wave موجودة. لا يكفي وجود هاي ال P wave، وإنما نحتاج إنه each P wave followed by QRS and each QRS followed by T wave, which is the sequence، الترتيب. يعني ال P تتبع ب QRS وال QRS تتبع ب T. لا نقبل أن نكون ال P تبعت ب B ومن ثم QRS، أو P ثم QRS ثم QRS. لا، نحتاج أن يكون هناك P wave followed by QRS followed by T wave. إذا صرنا حاكيين regular rhythm, the presence of the wave, the sequence of the waves, and the ratio. The ratio between P wave to QRS is 1 to 1. Each P followed by 1 QRS, not 2, not a 3. Or not 2 P wave in front of 1 QRS. So that the ratio between P wave and QRS should be 1 to 1. These are very important conditions to establish a normal a sinus rhythm, in addition to the measurements that we learned in the previous slides regarding the PR interval, which is 0.12 to 0.20, the measurement regarding the QRS, which is 0.04 to 0.12 من 4% إلى 12%. These are very important. In addition, other characteristics to determine if the ST segment is on the isoelectrical line, which is the normal, should not be elevated or depressed. We have to determine the QT interval measurement, and we have to assess if the patient is stable or not stable. Sometimes the patient may become bradycardia, لكن still stable, so that no need for medical treatment, just monitoring. We have to assess the regularity, regular rhythm or irregular, the rate, which is important, and the normal heart rate between 60 to 100 beats. The rhythm could be sinus but not normal, in which a sinus rhythm is present but tachy or bradycardia. The P wave presence and the relationship to QRS should be 1 to 1. The normal PR interval 0.12 to 0.20 second. The QRS width بعض الكتب تكتب 6% ل 10%. احنا تقيدنا بالشيء اللي شرحته سابقا وهو 4% إلى 12% second. This diagram clarifies the normal sinus rhythm. خلينا نطبق الصفات اللي حكيناها. أول شيء إنه the distance between P wave, the next P wave, the third P wave, the fourth P wave is equal, and the distance between the R to R to R to R is equal also, so that we have a regular rhythm. All waves are present. P wave present, QRS, T. The second beat, PQRST. In the third beat, PQRST. In the fourth beat, PQRST. In the fifth beat, PQRST. And in the sixth beat, PQRST. In addition, the sequence each P followed by QRS and each QRS followed by T in all beats presented in this strip. The ratio between P to QRS is 1 to 1. في عنا 1 P 1 QRS and the second beat 1 P 1 QRS. بالإضافة إلى نطلع على الميجرمنت القياسات للبي ويف للبي ار انترفال الاس تي سيجمنت اون ايزو الكتريكال لاين. هذول مش من صفات الساينس ريذم لكن من النورمال ريذم. اذا هو ساينس ريذم. حتى يكون نورمال يجب ان تكون الهارت ريت between 60 to 100. بنلاحظ انه في ثلاث مربعات كبار 3 large square present by between each R and R. يعني هناك ثلاث مربعات كبار موجودة بين الار والار في كل ستريب. فبنقسم 300 على 3 اذا الهارت ريت 100. من الابنورماليتي اللي راح نحكي عنها that originated from the SA node أو sinoatrial node هي sinus tachycardia and sinus bradycardia. Sinus tachycardia, all characteristics of sinus rhythm are present excepting that the heart rate above 100 beats per minute. The SA node discharge an impulse in a rate of more than 100 beats. Sometimes this could be reach 180 beats per minute. إذا بنلاحظ على هذا الستريب بنلاحظ إنه جميع خصائص الساينس ريذم اللي شرحناها في السلايد اللي قبل هيك موجودة. regular rhythm المسافة بين الار والار متساوية. البي ويف موجودة، الكيو ار اس موجودة، التي ويف موجودة. البي followed by QRS followed by T in all beats. And the ratio between P to QRS is 1 to 1. أي أن هناك 1 P تقابلها 1 QRS. هو sinus rhythm لكن هل هو normal؟ هو abnormal من حيث الريت. فهو sinus لكنه تكي فبنسميه sinus tachycardia. In this rhythm, in this strip, the rhythm is regular. The rate more than 100 beats. The P wave normal, upright, smooth, rounded. The P interval normal. The QRS complex, normal duration. The ST segment on the isoelectrical line. The T wave normal, symmetric, rounded in all beats. The conduction is normal, but the rate is more than 100. Based on these information, we can conclude that this rhythm is a sinus tachycardia. Causes for sinus tachycardia: fever, because of increasing metabolic demands at the time of fever, infection, anxiety, congestive heart failure as a compensation for decreasing cardiac output. There is increase in the heart rate to compensate for decreasing cardiac output and blood pressure to increase the perfusion to different body organs. Adrenergic stimulation in pain, anxiety. Also hypovolemia that may lead to decreased blood pressure as a compensation for tachycardia, anemia, pregnancy, vagolytic drugs such as atropine that may increase the heart rate. We explained previously in the first lecture the consequences of tachycardia that may decrease diastolic filling time so that the ejected amount will decrease and cardiac output will decrease. In addition, the coronary circulation receives the blood through or during the diastolic period. As we know, in tachycardia, the diastolic period decreases so that the blood supply through the coronary circulation will decrease and the ischemic may result. Treatment for the tachycardia is the underlying cause. لازم نعالج السبب. إذا كان في infection نعالج infection. ممكن نعطي أدوية تقلل الهارت ريت لكن we have to treat the underlying cause. من الميديكيشن المستخدمة to treat tachycardia beta blocker and calcium channel blockers وهاي already explained in pharmacological course. يعني انشرحت لكم بمساق الفارما. As we know that the beta blocker block the beta receptor that present on the heart, beta 1 receptor وفي beta 2 receptor in the trachea or in the respiratory system to decrease heart rate and blood pressure. Some drug of beta is selective and other are non-selective, and you have to know what is the difference between selective and non-selective beta blocker. Calcium channel blocker that block or prevent the entry of calcium inside the cardiac cell, so that decreasing the cardiac contraction.